your host, Dr. Stephen Blomerth, and you're watching Natural Health Today. And this is a show that's dedicated to the questions that you might have about your health, or your wife, or your husband, or your son or daughter, or friend or neighbor. And what we try to do is talk about natural health means by which you can help yourself without drugs, without surgery. I've been in practice for 37 years, and I've learned that probably 80 to 90% of day-to-day problems that people have, that they take to the medical doctor and get presented with a treatment that may involve drugs or surgery. 80 to 90% of those problems don't require drugs, don't require surgery, but can be helped by natural health means. So when I say natural health means, what do I mean? I mean any one or a combination of 4 different avenues that I call natural health. Probably the first avenue that I think of is manipulation of a joint that's stuck. Because many times people can have joints stuck in their feet, elbow, shoulder, hand, or back, that if it's freed up allows normal movement. When you have normal movement, you have decreased pain, and sometimes you'll have a total resolution of the patient's problem. Another avenue that I think of is muscle therapy. And I'm not talking about just a simple massage. I'm talking about detecting trigger points in tight bands of what we call fascia, which is the connective tissue that surrounds each muscle group. Because when you have muscles that don't move properly, they also can cause far-reaching effects. There are connections that go from your foot all the way up to the top of your neck and plug into your head. And any lack of movement along that entire chain from the foot out to the top of your head can cause you to have pain or lack of function anywhere along that line. The third avenue that I think of when I think of natural health care is exercise. And I don't mean the type of exercises that we stereotypically get in a gym. I'm talking about exercises that don't involve machines, but do involve us doing activities that closely mimic day-to-day activities, and usually standing on your feet. Exercises that have you laying down or sitting down have a certain value, but probably the most valuable exercises are things that you do standing on your feet. And these type of exercises that I've learned and incorporated into my health care are done by a group called foundation training. The foundation training people try to work the muscle groups that get the least amount of work and have the greatest effect to make you stable. They don't necessarily make you have huge biceps to brag about, but they'll make you stable so you'll be steady and pain-free and able to function doing your normal activities. And the fourth avenue that I think of when I think of natural health care, nutrition. When I think of nutrition, it's probably the single thing that you can do that has the longest term payoffs for you. Bad nutrition doesn't kill you overnight, but good nutrition helps you live longer, keep your weight normal, keeps you having normal energy, as well as resistance to disease, including cancer. So when you combine those 4 things, that's what I think of as natural health care. Some people need more of one or less of another. Some people need all 4 of those avenues at the same time. So what I do is invite you to participate in the show by sending in your questions, and there's 3 avenues that you can send in your questions. You can send a question in via email to pbdchiropractic@gmail.com, or you can telephone my office at our office telephone is 978-535-6155. You can even send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you choose to participate in the show, what we'll do is we'll read your questions. We'll disguise your name just a little bit so people won't know the exact nature of the problem you're talking about. And then we'll try to talk about natural health means to help you. And if there is no natural health means to help a particular condition, I'll let you know that too. Because sometimes it's good to know what can and what may not be well served by natural health care. So I'm going to put on my reading glasses and we'll have a look at questions that have come in since our last episode. All right. So Sandy writes in from Middleton. She says, I know everyone says it's bad for me, but my foot and my calf feels better when I'm wearing shoes with a heel. I only wear about a 3-inch heel, and my feet and calf hurts more when I take them off. So is there a good way to explain to my friends that they are wrong about wearing heels? I never wear the thin, spiky heels. Sandy, that's a decent question, because what Sandy is saying is she's heard that a lot of people say, well, if you wear heels, you'll get bad feet or you'll have pain in your calves. And she says, well, actually, my legs feel fine. My feet feel fine when I'm wearing them. It only bothers me when I take them off, so I think they're good for me. Here's the situation and why she thinks that they're good for her. When a person is wearing heels, their foot is in this position here like this. And the muscle in our calf that prompts us and gets us up on our toe like that is the muscle that's in the back of your calf. It has a couple fancy names, gastrocnemius and soleus. You don't need to know that. But when your calf muscle contracts, you go up on your toe like that. Well, when a muscle contracts, what it's doing is getting shorter. That's how muscles work. They get shorter. So if you put your foot in this position, by virtue of wearing the heel, the muscle gets shorter. And depending upon how long you are in that particular shoe, the muscle will tend to stay short. And so nothing hurts a muscle more than when it's shortened and then has to lengthen again. Let's use an example that you could probably understand. Imagine if you took your arm and forearm and just said, well, I'm going to contract this muscle here, the bicep, and I'm going to shorten it, and I'm going to put it in this position. And then you kept it in that position for the same amount of time that a person might wear a shoe with a heel. 5 hours, 6 hours, 7 hours. If you kept your bicep muscle in this position and didn't have it go out to its normal length for 5 or 6 hours, when you finally did move it, you instinctively know that would really hurt, really ache in that area. So the upshot of it is she's indicating she feels better with them on and worse when she takes them off. And that's the essence of muscle shortening. So is it better for your feet to have them on? In her mind, it sounds like it's better for her to have them on because her calf and her foot feel better when they're on than when they take them off. But the reason that they feel better when they're on than when they're taken off is they've held that muscle in that short position for a long period of time. Now it has to lengthen, and that's when it aches. So what can you do? Well, if you really have to wear a heel for some reason, whether it's work or some office dress code, what you should be doing is some exercises to strengthen your opposite muscle, because we have a muscle that opposes that tight calf muscle that runs down the front of our shin, but it's such a small muscle we don't even know it's there. But there's some exercises called shin pull muscles, or you can just walk around your house up on your heels as opposed to your toes, and that will strengthen the opposite muscle. By strengthening the opposite muscle, you sort of defacilitate or take some of the tightness out of that calf muscle. But wearing heels, even as little as a 2 to 3 inch heel for long periods of time, if you find that you feel better with the shoe on than with the shoe off, it's because you've brought about some shortening in that muscle. Shortening in that calf muscle that can be an aggravating factor when people have plantar fasciitis or pains from flat feet. So it is a good question, and it seems like a paradox, but the reason is having that muscle held in a short position results in it staying short for a long period of time and giving you pain. But thanks for that question, Sandy. Okay, our next question comes from Michael. Michael writes in from Danvers. He says, have you got a good exercise for my tight trap muscles? They get so tight the day after my workouts that I need to have my wife really massage them hard to get some relief. She does a pretty good job, but sometimes she's busy and she gets pissed off when I do stupid things like get achy tight traps every week. Okay, so let's talk about I will show you an exercise that can help that situation. But let's talk about why he might get those achy tight traps after his workout. First of all, the trap or the trapezius muscle, it's called the trapezius muscle because it has a trapezoidal configuration to it, which is a four-sided rectangle. But it has two parts. It has the part that everybody knows. This area here we commonly call our trapezius muscle, but our trapezius muscle, I'm going to turn a little bit sideways and show you how far down it goes. It goes down to about here. Nobody knows about this area that it goes down to way down here low in the lower part of our back, but it goes down that low, and that low portion pulls your shoulder blade down, whereas the upper part pulls it up. So when Michael's working out, it's pretty darn likely that he's doing something that I've always thought is foolish, which is doing shoulder shrugs, this type of thing. Many people will put weights in the hands and do these shoulder shrugs. The bad thing about that is our trapezius muscles, or at least our upper trapezius muscles, are at work all day long. Anytime you're conscious, they are at work holding your head up. And so to make them tighter is foolish because you're making tight a muscle that's working all day long. It's like clenching your jaw. How tight do you want your jaw muscles to be? They work enough. Most people know that having a tight, achy feeling in your jaw, you'd never say, well, let's do some exercises. Let's make my jaw muscle tight. No, certain muscles don't really need to be too much tighter. And that's true of the upper trapezius muscle. But more to Michael's point, he wants to know what he can do to not have those tight trapezius muscles. Well, one is the obvious thing of when he's working out, stop doing these. Stop doing the shoulder shrugs, and particularly the ones that have weights in their hand. But there also is a very seldom used, sort of a subtle exercise that exercises the lower part of the trapezius muscle. Remember I said the lower part of the trapezius muscle goes all the way down to about here. So I'm going to take my coat off, and we're going to do an exercise to illustrate how to do a little work for our lower trapezius. Okay, so what you want to do is externally rotate your arms like this. So that means turn your arms out like this. And then pretend that you have a piece of paper that you're trying to hold in your armpit. So bring your arms like this, and as if you're trying to hold a piece of paper in your armpit. And see how I'm forming a fist? Now my fist is going to sort of slowly punch down towards the floor. And if I'm doing it right, you should see my shoulders go down. Now I'm going to stop doing it, and you may see them rise up again. So again, I've externally rotated my arms. I'm clenching my fist a bit, not real hard, just enough to close my fist. I'm holding my arms in as if I was trying to hold a piece of paper in my armpit, and then I'm going to do this. I'm going to try to bring my fist down towards the floor. And if I'm doing it right, you should see a subtle degree of play of my shoulders going down. That play, that movement down, is something that helps us work the part of our trapezius muscle called our lower trapezius. So stop doing the exercise to strengthen the upper. Do some exercise doing the lower trapezius. And should you have weights in your hands? No. Don't put weights in your hands. Just let your body work naturally to wake up the lower trapezius, because when the upper trapezius gets strong, it kind of turns off the lower trapezius. They work in sort of like a reciprocal pair. The strength of one weakens the other. Okay. Ellen writes in from West Peabody. She says, my husband is lactose intolerant and he gets really bad cramps when he eats dairy. But he would love to have a cheesecake for his birthday. Will the non-fat cream cheese be the best to use? Well, I know some people at their birthday time say, well, I can go off my diet. So Ellen is trying to accommodate him and make him a cheesecake for his birthday, and she's asking, well, if she uses the non-fat cheesecake, will that help? Well, the word lactose intolerance means that you're intolerant to digesting lactose. And lactose is not a fat, it's not a protein, it's a milk sugar. Lactose is milk sugar. So if you're lactose intolerant, you have a hard time digesting the milk sugars. They irritate you. So if you get the non-fat cream cheese, you will take the fat portion out, but you're not doing anything to change the amount of lactose, the amount of milk sugar that's in there. So Ellen, don't bother to buy non-fat cream cheese if you're bound and determined to make a cheesecake for your husband. But there are alternatives. What you may want to do is, rather than using cream cheese, you can buy Greek yogurt. In the process of fermentation, the yogurt bacillus eats up a certain portion of the lactose that's in there. So a Greek yogurt, by virtue of having less, is going to be better. Is it lactose-free? It's not lactose-free, but if standard cream cheese has about 12 grams of fat in it, the Greek yogurt only has about 4, so it's going to be a low. Now, if your husband can't have any, you can buy cream cheese made with coconut oil, and the coconut oil will have 0, and that may be the best situation. If your husband is really lactose intolerant, making him a cheesecake with any dairy product is going to, be fraught with a little bit of danger for him. So maybe try, if you really want to make him a cheesecake, use the coconut yogurt, and that could be tasty and also not painful for him. But Ellen, that's a good question. Thanks for sending that in. Okay, Lisa writes in from Danvers. She says, my daughter had a chest x-ray last summer because her boyfriend fell on her and hurt her ribs. At the time, her pediatrician said that the ribs weren't broken, but she could see that she had a spinal curvature. Last week I brought my daughter to a chiropractor because my daughter now has low back pain. But they said the chest x-ray, but the chiropractor said the chest x-ray isn't good enough. So why was it good enough for the pediatrician but not for the chiropractor? Okay, we're running into a little technical thing. But, well, when the pediatrician heard that her daughter had chest pain from the boyfriend falling on her, she concentrated on this area here. A chest x-ray is basically wanting to see your lungs. to see if there's something wrong with your lungs and your ribs from here to here. And she was informed that they could see a spinal curvature. Well, what that means is that in this area of the spine from here to here, you could see something side to side, because ordinarily what we want to see is a straight line here. You want to see the spine making a straight line, not zigging, zagging left to right. The downside of the x-ray that only goes from here to here is it doesn't show the spine all the way down to the sacroiliac and pelvis, because many times when people have scoliosis or that curvature of the spine, part of it can be due to having a short leg on one side. So the x-ray doesn't go low enough. You can't take a chest x-ray and call it a chest x-ray that's supposed to only go from here to here and include all the way down to get the legs. And of course these would look a little bit different than I look now, because it's in the standing position. So it isn't that the x-ray is no good as a chest film. A chest film tells us certain things about the lungs, but it isn't sufficient to see down into the hips, because we want to see the hips if a person has a potential zigzagging of the spine, because you might be able to help them by putting a shim in that person's shoe. If they have a short leg on one side, that may even things out. If you even out the legs, it might help even out the spine. So I hope that helped answer your question. It's just a question of, you see a bit of a curvature of the spine, but you don't know where it's emanating from. Is it emanating from a short leg? How bad is it down in the low back, and at what level does it start? So that's why the x-ray wasn't good enough for one doctor, but was good enough for another doctor to make a passing comment. Okay, the next question comes from Andy. He writes in from Danvers. I've seen your show enough to know that you advise exercising some muscles but not others. How do you choose which muscles to tell a patient to exercise and which ones not to exercise? Well, that sort of dovetails in with Michael's question about exercising about his trapezius. Well, before I tell any patient which muscles to exercise and which ones not to, it depends on the specific nature of their condition. For instance, if they have a condition brought about by running too much distance, I'm going to give certain exercises that'll have a lot to do with strengthening that muscle that runs down the front of the shin that we were mentioning before, because that's an exercise that isn't going to bother their calf, but may help restore the muscle balance between the two. If the person has tight muscles up in this trapezius area, I'm definitely going to tell them about not doing the shrugs and about doing that other exercise that kind of pull their shoulders down a little bit, pull the shoulders down like that. But in general, the types of exercise that I recommend to people are exercises that work the small muscles that don't get too much exercise. Another group of muscles that don't get much exercise are the muscles that ride on the inside of our thigh, on either side, what they call the adductor muscles. The reason that they're important is that these muscles plug up into the pelvis. The pelvis is part of a ring, and that ring is part of what our spine sits on. And if you make the ring more stable by having stronger adductor muscles in here, you help stabilize the spine. How do I recommend exercising those muscles? In general, I never recommend machines, because when you work out on a machine, they say, well, it helps isolate the muscle. I've heard that so many times. Well, isn't it good to really isolate that muscle? Well, in the real world, we don't isolate anything. When we're taking part in a sport, when we're doing an activity or a job or just walking around, we're using all our muscles not in isolation, but in conjunction with all our other muscles. So the interaction, the interplay between one muscle group and the other Because that's important in day-to-day activity to be stable, it's just as important in your exercises to make your exercises mimic day-to-day activities to make you stronger to do those very activities. So standing, yes. Sitting, not so much. Laying down, to some degree. But to be on a machine, to isolate the muscle, to say, I really want to hone in and isolate that muscle, why would you want to do that? Because in the real world, we don't act that way, we don't react that way, and we don't respond that way. We respond as groups of muscles working together, passing the weight from one area of the body upwards or downwards, depending upon the activity. So I always urge all my patients, no matter what their problem, have a look at the Foundation Training website. Have a look at their streaming. I think it costs $15 a month. You can turn it off after a single month. You don't have to watch it forever. You could if you like it. I happen to keep my streaming on all the time, much like I keep using my water pick to keep my teeth healthy. It's just something that you can do for yourself that you'll probably do better with a little help than trying to do it on your own. Trying to learn these things on your own, pretty difficult unless you're in that line of work, but pretty good to have a good person, a coach in your corner, showing you simple exercises that involve no machines, no heavy weights. Are they easy? They're not that easy. Are they too hard? You can make them as easy or as hard as you like by how many repetitions you do. And they start easier and they progress. So I guess that's how I handle deciding which exercises to give to people. I urge them not to do the exercises that for muscles that get a lot of work anyways. Our calf muscles, they get a lot of work just from us walking around. Our shoulders muscles, the trapezius, they get a lot of work from us just being conscious and walking around with their head upright. Those muscles don't need exercises. It's the little muscle work that oppose that area that need more work. So we've about come to the end of our show time. So I want to say thank you to the people who sent in their questions. And I want to open up an invitation to our viewers to, you can participate in the show too. You can learn something. You can find out some information that might help you or a family member. So send in your questions. There's 3 avenues you can send your questions in. You can send them in via email to pbdchiropractic@gmail.com, or you can telephone my office at 978-535-6155, or you can send an old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you decide you want to participate, we'll be glad to read your question, disguise your name a little bit, and then we'll talk about natural health means to help you. So thanks for watching Natural Health Today. I'm your host, Dr. Stephen Blomerth, and thanks for watching. See you next time. Bye-bye.